r/AskReddit. What's the most unprofessional thing a doctor has said to you? Well, duck me sideways. Got an x-ray of my back hips. Doctor's first time seeing them was with me in the room. That, folks, is how I found out my back is broke. Edit. For those asking. One of my legs is longer than the other, so my hips don't align. Anything involving moving my hips since I was a kid has basically made the base of my spine grind against itself. By the time we figured this out, my L4 and L5 discs has nearly degenerated to nothing, and my sciatic nerve was basically sitting there waving at everyone without any protection in that area. I respect that. Wouldn't even be mad at that response. I had a leading allergy specialist say to me, well, I'll be ducked if I know, after lengthy investigation over several weeks into my post-nasal drip issues. He had tried everything and was all out of ideas. I didn't mind at all. In fact, I rather appreciated his honesty. Similar thing happened with my father-in-law. Men in that family have huge heads and thick necks. Not fat. Just structurally over-engineered. He was having neck pain and went in to get a surgery consult after seeing other doctors. The doc comes in for the consult, takes one look, and says, if my head was that big, my neck would hurt. 2. My about fell over laughing, and they had a great working relationship from there out through the recovery. You sure he didn't fall over from the weight? Doctor was doing a pap smear and he said whoa at one point while the speculum was in. I never did find out why, but I'm assuming he was just amazed by my awesome vagina. Doctor was doing a pap smear and he said whoa at one point while the speculum was in. What the hell is that? Hit. Keith. Keep it together. Play it cool. She doesn't know you're the janitor. Okay miss. I'm done with your burgeoner. I need you to be fully firm, referring to my penis. I was referred to a urologist for Peyronie's disease. I believe my penis has been developing a bend in it. As part of his assessment, the urologist gave me an injection in the penis and some pornography. He left me alone in the room so I could become erect. Then he returned and used a vibrator to make me fully firm. However, when I told him I was going to have an orgasm, he just kept going and I ejaculated. He then took some measurements with plastic rulers. He said that he needed to do this to take reference measurements to see if my condition is worsening. I have no idea what measurements he took because I was frankly overwhelmed by the experience. For him to look at my erection didn't seem completely implausible. After all, I couldn't see a problem unless I was erect. Getting me fully firm, well, that was stretching my credibility. And when he kept going until I ejaculated, that just didn't make sense. I asked about this on an online urology forum and found that this is so far outside of ethical practice that nobody would take me seriously. They assumed that I was trying to share some homosexual fantasy I had created. Nobody believed that a urologist would act in this way. I'm not gay. And if I was trying to create a fantasy, I think I could do much better than this. Please tell me you reported this guide to someone? No. Based on the comments I received on the online urology forum, it seemed unlikely that anyone would believe me. It wasn't something he said as much as something he did. I came in for a suspected broken leg and he had a couple of residents with him. After the x-ray and having already found out my leg was indeed broken, he grabs my leg and looks to the residents and says an old but reliable method for diagnosing a broken leg is to place a hand on the ankle, a hand on the knee, and place your knee in the center, then pretend like you're trying to break a stick. If they yell, their leg is broken. He actually ducking did it to me 3 times to teach these residents. I haven't been back to him since. Bro, I would have punched him if he tried that hit. I'm not a violent person, but he's literally talking about pushing a broken bone with his knee. That's bull. Dude. That's only part of it. The whole reason I had to go to him, family DR, is because the hospital duct hit up. The day I broke it, I went to the hospital and had it x-rayed. They said I just bruised the bone, but didn't break it. They sent me home with some meds and that was that. Well, 1 month later it was still hurting just as bad. So I went to the DR from my original comment. Like I said, he diagnosed my broken leg. I had been walking around on a broke leg without a cast for 1 month. It even grew back crooked. I even paid the hospital $500 for their x-ray. I guess the moral of the story is that if you're 240 pounds, don't play on rope swings. Went to a psychiatrist because I wanted to kill myself. He said, "Well, you don't seem sad. I can't really help. You know how to spread M." Was at the gyno's office and needed to open my legs a little more in the stirrups during the examination. My first gyno appointment as a teen. And I was embarrassed and reluctant to spread my legs. The DR slapped my knee and said, "Pretend I'm your boyfriend. Spread them like you do for him." I wasn't even sexually active. I was having medical issues. That's why I was there. Whoa. That's inappropriate. My mom's first gyno appointment with an elderly male doctor. She didn't to open her legs to him. He said, "You really think you have something down there I haven't seen before?" He turned out to be a really good doctor. And my mom uses the story to remind me not to be embarrassed of it. Everyone has. Not said, but done. I was 12 years old at the pediatrician having a physical. A youngish, probably late 20s early 30s, attractive, to my 12-year-old brain, blonde woman doctors gives me my physical. It comes time to turn my head and cough. I have a 12-year-old boner in anticipation. She does the whole check for hernia thing. Then just before telling me I can pull my pants up, she flicks the head of my penis down with her finger, springing it like a diving board. She smiles slightly and continues on with the rest of the physical like nothing happened. I don't know if she was trying to make my 12-year-old mind feel at ease about the embarrassing, to me anyway, situation, but I've never forgotten that moment. Edit. Spelling. During my first physical at about the same age, my female doctor counted my testicles, saying 1 thingy dingy, 2 thingy dingies, probably trying to put me at ease. But it was so weird and out of place. I had one when I was much younger, and distinctly remember the nurse referring to them as willy beans. Which, what the duck? I had a positive pregnancy test and went into my OB to get a blood test confirmation. Standard practice is to repeat the blood test after 48 hours to see if your HCG levels have doubled, which indicates a pregnancy is progressing normally. About 10 minutes before my second blood draw, I received a call from my OB's office. Since I was already in the hospital parking garage at that time, I decided to just go into the office to see what the call was about. In the waiting room, full of patients, a nurse decided to tell me that I was miscarrying and they called because they wanted to save me the trouble of getting my blood drawn. I made her draw my blood anyway, knowing that there was no way they could diagnose a miscarriage with only half of the information. Then proceeded to walk out of the office in tears, in front of everyone who had just heard what she had told me. Sure enough, my numbers had doubled. They unfortunately continued to fluctuate after that, which indicated that I was not having a miscarriage, but an ectopic pregnancy. Undiagnosed, an ectopic pregnancy can lead to serious complications, including rupture of the fallopian tube, internal bleeding, and potentially death. I continue to go to that OB office because my doctor is amazing, but that nurse is on my hit list forever. That nurse deserves to be fired. If everyone heard her tell you about the miscarriage, that's a massive privacy violation. In addition to her being horribly callous and an idiot. Did you tell your doctor about it? Because I'd assume most good doctors wouldn't want someone like that on their staff. I did tell my doctor about it, in regards to the confusion that it created. But in all the stress and turmoil of getting the proper diagnosis and treatment, following up on what happened to her was the last thing on my mind. My doctor was incredibly sympathetic. I haven't seen that nurse around the office since. This happened back in January. And at about 18 weeks into a viable pregnancy at this point, I've received really wonderful care from the staff that I have interacted with this time around. If I do happen to see her roaming the hallways, I might just chew her out and blame it on the hormones. Look, I shouldn't do this, but I'm going to call you on my later on this evening and we'll discuss options off the book. It's my personal number, so I would appreciate you kept it to yourself. Highly unprofessional. Hugely helpful. Best doctor I've ever met for sure. My OB gave me his personal cell phone number and saved mine when I was pregnant. I could text him and he'd text back. He personally called me from his phone to let me know that the genetic blood tests that check for any hereditary defects had come back normal. He was great. Is that unprofessional? I had a DR who knew I suffered from terrible allergies and sinus inflammation every spring. And I was getting married. She scrounged around for pharmaceutical samples of anti-allergy and sinus medication for me, and of course didn't charge me for them, and gave me her personal number, telling me to call me over the weekend if my symptoms worsened and she'd see what else she could come up with. Turns out I didn't need it. The stuff she gave me worked great. But I appreciated the gesture. Didn't occur to me that this was unprofessional. I thought it was just going above and beyond as a doctor. When the doctor told my dad that he had cancer in various spots, including his bladder, colon, lymph nodes, and prostate, my mom started crying. Obviously. The doctor sneered at my mom and told her to get a grip. Ducking asshole. My dad's okay. BTW. Well, you're sitting here talking and smiling. You can't be that depressed a psychiatrist a few years ago. Yeah. Duck that. It's not hard to learn to slap on a happy face in public so people stop asking questions. I did it for years. Right? That was probably the third thing he said to me. He hasn't even asked me a question other than why are you here today? I've had the worst luck with shrinks. 2. Repeated asked if I could be pregnant when I was like, I have ducked up periods. Yo. I'm lesbian and in a committed relationship with another woman. There is no chance in hell I could be with child. Stop asking. My endocrinologist, have hypothyroidism, is trying to figure out the ducked up periods. But have had them for ages. I badly burned my hand in my college cafeteria and went to the campus health office. I showed the skin literally dripping off my hand begging for a cream or bandage or anything to ease the pain. After making sure I wasn't allergic to anything they asked if I was sexually active. I wasn't but didn't see how it was relevant to my burned hand. She then moved on to my current medications. I was on an asthma inhaler, ADD meds and birth control. She looked up at me with a smug grin and said if you aren't sexually active, why are you on birth control? As if she had caught me. I yelled back in her face while clutching my blistered hand in case the mood strikes me. Now, if my sex life is out of the way, can you fix my hand? Women are on birth control for lots of reasons. My ex was a virgin and took it because it relieved her cripplingly painful periods. Some women get irregular periods. That nurse is a cunt. That's why I was on it. And regardless if I'm a virgin or the biggest three-hole wonder in town, what does IT have to do with a burned hand? My DR is also my best friend and I routinely have to get surgery because of a medical problem. When he is cutting into me somewhere I cannot see, he often says oops. Somehow, saying my doctor is my best friend sounds creepier than my best friend is my doctor. It makes it sound like a one-way street. Like the doctor is their best friend. But the doctor has no idea they are even friends. I was dating a girl for a while and we both went to the doctor to get tested for STDs. When she is done he grabs me and brings me into the room. We chat for a bit and says, you know, I probably wouldn't date that girl if I were you. When I was military I was dating a girl. One day she calls me and tells me that she had chlamydia. My tests came back negative. I was on the phone with the Navy doc and he said, Doc, you know what this means, right? Me. Yes. Doc, your GF that you were in a monogamous relationship with had an STD and you didn't. Me. Yeah, I get that. Doc, let me rephrase. She got it from somewhere. That wasn't you. Me. I got it. It'll be dealt with. Inappropriate but looking out. Folks out here fall for their nollie caught from a public toilet bus seat. It's not cancer. You don't need to get this checked out. I got it checked out. It was cancer. Sorry man. I had opposite problem. Doctors in oncology lab told me I was only there because they had the best equipment to find out why I was anemic. They told my wife, however, that I had cancer. Somewhere in that they are just looking for it. They further told her not to tell me because it would stress me out. My poor wife was crying whenever I wasn't around. I had a heart infection. No cancer at all. A psychiatrist told me that he didn't have time for my craziness. After lying to me for weeks telling me that I was on the waiting list for therapy when I wasn't, I found out when I went to the psychology department I had been discharged without a letter to me or my GP. Next time I saw my psychiatrist he asked how it made me feel. I told him that it felt like no one cared and just wanted to do me off and tell me what I wanted to hear rather than check to see if what they were saying was even true. Psychiatrist said to me, that's just your depression making you feel that way. No you asshole, it's 7 weeks of you telling me I'm on a list and saying you've been checking it yourself when you clearly hadn't. Anyone would feel fobbed off. Infuriating. Doc, I feel really nauseous and dizzy. That's just your food poisoning making you feel that way. No hit. Can you maybe do something about that and also maybe stop making it worse by feeding me terrible food? I was booked to discuss possible knee surgery with a specialist. After several years of physio and many MRIs showed an old injury is not improving. So after a long wait where literally 30 plus people who enter the waiting room after me get seen before I do. I get in the room and the first thing he tells me is that he saw I was next. Then deliberately delayed my appointment by 4 hours because other patients were easier to sort out. That's actually what he said. So I'm already pissed off. He genuinely thought I should be okay with an extra 4 hours wait and no apology at all. Then he can't remember which knee is the issue. I tell him. He glances at the scan and says, well, I understand women sometimes feel pain much more than men. But this is probably healed now anyway. Healed. Despite causing issues for 7 years. It's now probably healed? He asks if the pain impacts my life. I listed all the hobbies I've given up. THR trips that have been ruined. The flat shoes I had to wear as a bridesmaid because I couldn't walk in heels without crying. He nods along. So I ask him if I need to take my shoes off for the exam and he says that's not necessary. He's seen my notes and doesn't think my knee has any problems because if it did I'd need a wheelchair. Excuse me? I was in that room less than 3 minutes. He didn't look at my leg. He told me if it still hurt to go up and down stairs and collapsed when I tried to squat in a year. He'd have another look. I rang my doctor immediately. I was furious. She looked over my notes. He wrote that the patient is fully healed and the injury does not affect her in any way. He actually wrote that on my medical records next to a week-old MRI showing 3 massive tears in my tendons and abrasions on the bone. Yes. Magically healed. My doctor wanted me to go back. I've told her I will never speak to that man again. And we're figuring out what to do now. That's ducking disgraceful. Even if you were completely healed and making things up. The doctor still should have thoroughly checked it out. And suggesting to wait until you can't walk upstairs? Knee problems are no joke and I hope you get the help you need ASAP. I've broken my left ankle 3 times. Sprained and strained it so many times I've lost count. I have to do a yearly run for my job. 1.5 miles in 18 minutes. Not a grueling pace. But it is on loose gravel over uneven ground. And so my ankle always wants to give out. I finally got approval from my job to do the 2-mile walk instead if I got a note from my doctor. I go in. Argue with her for about 20 minutes about needing a note. I have taken off my shoes and socks so she can look at my ankle. And she is outright refusing. I tell her the ligaments and tendons are all stretched out and show her how I can pull my foot away from my leg by about a 1/4 of an inch. Everything is so loose. She still refuses to even touch me. She finally just wrote me a note. But not once did she touch my foot or check my ankle to see it is weak and has an incredible range of motion compared to the other. I found a new doctor after that. One of the doctors in military recruitment post, military service in Russia is mandatory by the way. That's important. She looks at me and says something like okay. You're fine and writes down in my file that I'm healthy. I'm like excuse me mom. I recall having pretty visible scoliosis for my entire ducking life. You may want to consider checking my previous check record from 2 years ago in the same ducking file you're holding. To which she replies oh? Well. It seems to be gone now. This is usual when teenagers grow up. Russian recruitment posts are truly miraculous places. Hundreds of thousands of diseases were cured there in just 1 or 2 health checks. Don't worry. Eventually it will curve enough that it will straighten again. I had just turned 15 and was getting a throat swab. Male DR noticed that I had lost my gag reflex. Told me not to worry because it would come in handy in the future for certain adult activities. I looked confused, so he repeated himself with more of an emphasis on adult. No. I wasn't confused about what you were implying, you idiot. I was confused about what made you think it was a good idea to say that. Had known the doc for years and never said or did anything creepy before or since. So I'll let it slide. At least you can be a sword swallower now. You could lose 5 pounds. 2 problems with that. It was my husband's doctor's appointment. I could lose about 25 pounds. Thanks for watching and be sure to subscribe to RedditQueen for the best daily content.